all through the year, we've had we had some town halls, we had webinars, and then we got together with our other colleagues from across the globe, including EBMT, and we were together for a number of those things through the year, actually all through the year. And we also had the Chinese bone marrow transplant folks join us for one of the webinars. We had the Asia Pacific bone marrow transplant folks join us, and we had specific European countries besides the big umbrella of EBMT earlier on during the pandemic, especially when Italy and Spain were more affected. So we actually did webinars with them. So it was a learning curve like everybody else. And we had real-time guidelines. Some of it changed as we learned along. And some of that was best practices, not necessarily based on any hard data or science. We just didn't have science at that time. So I think all through the year, we have updated our guidelines, and our infectious disease group has been spectacular on that front. And we've put out most recently guidelines on vaccination in transplant patients. Again, these are guidelines, best practices, not evidence-based science, because science hasn't quite evolved to that level at this point. So we've and our initial guidelines were really geared towards when to transplant, who to put the transplant or cell therapy infusion, not take them in at that time, what to do with the donors, and how do you actually deal with the graft itself after you've harvested from the donors, when do you check for COVID-19 or the coronavirus, SARS-CoV-2, how many times do we check that before transplant, how do we manage them post-transplant. So we have had guidelines for every one of those, and including the therapeutic side of it, which continuously kept evolving all through the year, and it still keeps evolving as we speak. So I think we have tried to update it to the best available science for the therapeutic side of things and the practice side of things. So yeah, I would say we've spent major part of the year, it's not an exaggeration to say about 80% of the time of the year on this aspect alone. So yeah, I mean, I think our most recent guidelines for vaccination and everything was made available on our website. It's freely accessible. And our guidelines were made along with ASH, actually, for the vaccination. The transplant side were made with EBMT early on, but the vaccination side is broader heme malignancies and transplant and cell therapy with ASH.